Hello there, I am Dr. Purnendu Roy. I am a surgeon in Genesis Hospital, Koshpa, Kolkata. A new parent recently came with their newborn child in my chamber and started asking a lot of questions about circumcision. When should it be done? How is it done? What type of anesthesia for such a small child? And whether it is done in Genesis Hospital, what are the benefits of circumcision? So I thought we will discuss the different aspects of this so common procedure, circumcision. So what is circumcision? Circumcision is the surgical removal of the skin covering the tip of the penis. So why is circumcision done? Circumcision is done in certain sects like Jewish families, in Islam families, and sometimes in certain families as a tradition for cleanliness and health benefits. Now, barring aside the religious ground where circumcision is done, coming to the point of when is circumcision done out of necessity, many times we must understand that this foreskin becomes tight at the tip where the foreskin cannot be retracted back, and this condition is called phimosis. And in children, sometimes when they try to pass urine, because of a small narrow opening in front, the foreskin starts getting swollen up like a balloon, and this is called ballooning effect, and there we need to remove the foreskin. Below the foreskin, there is a type of secretion, whitish secretion, which collects and which is called smegma. So what are the health benefits of circumcision? Number one, easier to maintain a good hygiene. So people who are not circumcised, these boys should be trained how to retract the foreskin and clean their penile tip area, that is the glans penis. Number two, circumcision actually decreases the incidence of urinary tract infection. Number three, it also decreases incidence of sexually transmitted disease. Number four, smegma, which is a substance which is secreted in the penile coronal area in uncircumcised penis. This smegma collects, and people who do not have the habit of retracting the skin and cleaning it, they can develop a higher chance of cancer of the penis. And it is noticed that women who develop cancer of the cervix usually are in people who have multiple male sexual partners, and it is the factor which is blamed is the smegma. Lastly, a phimosis, which is when the tip of the penile skin gets so tight that it can't be retracted, and then inside one get infection called balanoposthitis, and sometimes if there is forcible retraction of the skin, there can be tear of the skin, and if this tightness ring at the tip goes behind and gets stuck at the base near the corona, it gives rise to a condition called paraphimosis, when whole thing gets swollen up and it requires a surgical intervention. It's a very simple procedure. It can be performed in local anesthesia by injecting xylocaine at the root surrounding at the base, or it can be performed by giving an injection in the spine, which is spinal or epidural, or it can be done under general anesthesia. The foreskin is excised and stitches are put between the mucosa and the skin. Usually these stitches are put with absorbable sutures so that one doesn't have to worry about going and removal of the stitches. After the procedure, the patient is usually able to pass urine. Very small dressing can be applied which the patient or the relative can take care at home. One should not have so much of fear that what will be the post-operative period, and usually within 2 to 3 days time they should be able to wear clothes and start going back for work in no time at all. Well, if you have any problem, if you want to talk to me, if you want consultation online or in the chamber, please get in touch with us, Genesis Hospital, Koshpa, Kolkata, in the following number. If you like this video, like, share and subscribe to my YouTube channel and continue watching more videos on healthcare, education, charity and food and beverages. Thank you very much for watching. Watch out for my next video, which I'm coming up with soon, on hernia, different types and the surgical repair and complications.